Good morning, everyone. We are reporting 42 new cases of COVID-19 in the state. This does include 5 new hospitalizations and 4 new deaths, 1 each in Minnehaha, Oglala, Lakota, Todd, and Union counties, those deaths. We have 74 newly recovered individuals in the state, as well as 452 new persons who have tested negative for COVID-19. We did have a little bit of connectivity issues in getting some laboratory tests into our system over the past 24 hours, which does reflect a little bit lower numbers of tests from yesterday. So I do anticipate that our numbers will be back up for tomorrow's overall number of tests. This does bring our total COVID-19 case count in the state to 7,694. We have 842 active infections, as well as 6,737 recovered individuals. We have 61 individuals who are currently hospitalized, and now a total of 115 deaths. We have had, since the start of the COVID-19 pandemic, 86,342 total persons who have tested negative for COVID-19. As far as our community impact map, we have 3 counties that have substantial spread. Those include Corson, Hutchinson, and Lake counties. We have Butte County being elevated from none to minimal to moderate spread. And we have 2 counties which were lowered to no community spread, and those include Hyde and Sanborn. We do have 1 new cluster update for today. We have a long-term care facility, Aventera St. Cloud, which has now 40 residents and staff that have tested positive for COVID-19. The new cases by county include 1 in Aurora, 1 in Beetle, 1 in Brookings, 1 in Brown, 3 in Buffalo, 2 in Dewey, 1 in Fall River, 2 in Hughes, 2 in Lake, 1 in Lincoln, 4 in Meade, 2 in Millette, 6 in Minnehaha, 4 in Oglala, Lakota, 5 in Pennington, 2 in Perkins, 2 in Spink, 1 in Union, and 1 in Walworth. For our deaths by county, we have 8 in Beetle, 2 in Brown, 3 in Buffalo, 1 in Butte, 1 in Falk, 2 in Hughes, 1 in Jackson, 1 in Gerald, 1 in Lake, 1 in Lincoln, 1 in Lyman, 1 in McCook, 1 in Meade, 61 in Minnehaha, 1 in Oglala, Lakota, 22 in Pennington, 3 in Todd, 2 in Union, and 2 in Yankton.
All right, I'm going to go ahead and unmute our lines, then I'm going to make sure that we have Secretary Malcolm Risden on the line, and then we'll take your question. Secretary Malcolm Risden, are you with us? Kim, are you able to hear us?
Can you hear me now?
Yes. All right, we are ready to take your questions.
Hi, Ray from Kettleland.
Go ahead, Ray.
Yeah, we've been talking to health officials in neighboring counties about mass testing, and when, in particular, some areas where they've seen just a slight uptick, and they talk about the benefits of contact tracing related to that. I guess I'm just looking at some of the counties where there have been upticks. Would South Dakota benefit from that approach at all? As far as for contact tracing as a way to help contain?
So,
Ray, go ahead, Josh.
I was just going to say, so yeah, we do have, as part of our normal process that we do reach out and part of the investigation, identify individuals who are those close contacts, notify them, and then they, if they're symptomatic, there's a recommendation from the Department of Health that they contact their medical provider to evaluate whether they should be tested asymptomatic close contacts to be tested in those situations. There is a level of prioritization that is also part of that CDC guidance, and so medical providers are able to take a look at that guidance, make determinations of the I guess focus of whether or not they should test an asymptomatic close contact based on those priority groups.
And this is Kim Olson-Rice. And Ray, I would just add that the department has supported mass testing efforts of various communities and various specific populations. And so that has been a strategy that we have supported. And then as Dr. Clayton has mentioned, anytime we do see a positive come through as a result of a mass testing event, then we do follow up with that contact tracing to try to minimize its spread.
Right. I just want to follow up on that. It seems, I'm not sure if this is the right word, perhaps less aggressive than what's happening in Iowa and Minnesota in terms of mass testing. Looks like communities can actually request that from the DOH and say, hey, we've seen an uptick of 20 cases perhaps or 30 cases. We need mass testing. There seems to be a difference in the approaches. Can you help me with that?
Well, again, I would just add that each state is, looking at kind of their unique population's needs. When we have seen potential community upticks, we have looked at how testing can play a role in helping to see what's going on and decrease that spread. And so, other states have looked at that differently, and they're doing, kind of different approaches to testing, but we feel very confident and, have submitted our testing plan to the federal government, and they have reviewed it and feel that it's appropriate for us.
Thank you.
Next question.
This is Morgan from the Arkansas.
We'll go with Morgan. Is that what I heard first?
Thank you. So we talked about this on Monday, but I just want to double check since we're almost 14 days out from the July 3rd fireworks at Mount Rushmore. Have you seen any cases emerge in any South Dakota residents or out-of-state residents that were at that event? I've been told that, a majority of the people there were from outside of South Dakota. So is there even any way for us to know if there would have been an outbreak or spread there?
Yeah, so the part of that process, as all states do when they're investigating, is to notify the jurisdiction where some of the exposures may have occurred, so that way if there are close contacts, that the jurisdiction where those close contacts occurred, can notify individuals. And so through that partner process that we have with other departments of health, we would be notified, of any sort of potential exposure event. And at this point, that is not something that, we have seen as a concern among South Dakota residents, and not received any report from additional states that may have had individuals at the firework events.
Okay, and I have a second question really quick. Is there any word on how that outbreak occurred or when it started at this is the second Ontario facility in Rapid City to have an outbreak. Can you kind of talk to why that is or what happened?
Well, I think the focus is that, the facility was able to identify these cases, is taking steps to decrease the spread of transmission, and, upon identification of the first case, there's a focus on that point prevalence survey to identify anyone in the facility who may be infected. So, I think it's the focus really is on the response, that has occurred at the facility, as opposed to trying to guess where the point source for infection may be, as that is often difficult, if not impossible, to identify, not only for COVID-19, but also for many other infections.
Thanks.
Next question.
Todd at Kello.com News.
We'll go to Todd, and then we'll go to Lisa.
Yes, thank you. We've seen a number of major retailers that are mandating mask wearing. Either some already have, like Costco and Starbucks, and then some will start on Monday, like Target and Walmart and CVS. Do you foresee the Department of Health recommending to Governor Noem, since she says South Dakotans should exercise their own good sense, of an executive order that prevents those stores in South Dakota from being able to mandate that their customers wear masks? And then I have a follow-up.
So, Todd, this is Kim Malsom-Risden. You know, as we have done at the Department of Health since the beginning of COVID, you know, we have followed the CDC guidance relative to response and prevention efforts, and we will continue to do that, including their recommendations regarding masks. I think folks would be are pretty clear that the governor does not support the governor does not support government mandates, including a mandate from the government to wear masks, but does obviously understand that businesses, you know, may take different approaches to minimize COVID spread within their facilities, and I think respects the right of those businesses to make those decisions.
So why do you think those businesses are making that decision? I mean, you know, it's free enterprise, and people say, well, this interferes with my right as a customer to go in and shop as I want to shop. So what do these companies know about mask wearing that apparently the state of South Dakota and some other states don't understand?
Well, I wouldn't characterize it as a understanding or an issue with understanding. I would characterize it as just the way that those businesses want to go about, you know, putting guidance out there around masks in their establishments, and they certainly have the right to do that.
All right, thanks.
Now we'll go to Lisa from the Argus Leader.
Yeah, just the change in hospital reporting to HHS instead of the CDC change anything about how the state is getting data or reporting data?
So, Lisa, this is Kim. I can tell you a little bit about that. Most of the hospitals in South Dakota already were using the HHS system in addition to reporting to the state, and so we do not anticipate any disruption in the data that we receive around hospitalizations, and especially around individuals hospitalized with COVID or utilizing ventilators, the information that we have on the website. So we don't see a problem with that. We have less than a handful of hospitals that will need to convert from the CDC system back over to the HHS system, and we're assisting them with that.
Okay.
This is Stephen Gross from the AP.
Oh. Go ahead, Stephen.
I had a question on the out-of-state contact tracing. I just wanted to be clear as far as how many people from out-of-state the department has conducted contact tracing on, either in connection with the Mount Rushmore July 3rd event or other tourist events.
So the contact tracing is done by the health department where the individual resides. So it's regardless of where they were tested. That report is submitted back to the state of residence for any individual that tests positive, and that they are the ones that conduct the case investigation. The Department of Health, may contact an out-of-state resident before necessarily knowing that they reside out of state, but those are minor situations, not the standard. So, sorry, did that help answer your question?
I think it did. I'm just wondering, to be clear, in responding to an earlier question, you had said that the state had not been notified that there had been out-of-state people who had coronavirus infections at the Mount Rushmore event. Am I hearing that clearly? Is that right?
Yes, that through the investigation, any investigation, regardless of where an individual was tested, if they were tested, if they developed symptoms following the 4th of July fireworks at Mount Rushmore, that none of those investigations yielded information that was passed along to the Department of Health as far as there being any potential exposure events, and that again is if there were any cases that had been identified among individuals who had even been at the fireworks event.
JP from KON News Radio.
JP, go ahead.
Thank you very much. Dr. Clayton, was there a 5-case jump in Davison County from yesterday?
As far as new tests that have been performed, we have no new tests for Davison County. There may have been some individuals who have been reassigned. Their infection or their case has been reassigned to Davison County, but I don't have yesterday's information. And that is not uncommon for individuals as part of the investigation process that Department of Health identifies a corrected address for that individual and then places them in that appropriate county.
Okay, because here's what I have. On your trend data for Davison County, I see 5 new cases, but yet in the number of cases over the last couple of days, I see 57 as the current total. The math doesn't seem to add up between the trend line and the total of cases in Davison County. I was just wondering, where does the error lie?
Well, and the other thing to note is that the information, within that trend, is based on the date of test report to the Department of Health, and so it doesn't necessarily equate to existing cases that we're reporting today. It depends on when those when those cases were reported and how they're placed into that graphic.
Well, which one should I believe?
Well, there are two different. The total count for the county is still that total count. The number of new cases that are reported today is based on the investigations that have been completed by the Department of Health, and the date of test is going to be populated as far as when the Department of Health received that information from a reporting entity, whether it be a submitter and so on. So.
Well, that's still confusing because again, the trend line is showing a 5-case jump from yesterday, and yet it still says 57. There's a math error somewhere. That's all I'm pointing out.
I still think that there's just maybe a misunderstanding of how that the positive test date is in there versus when we're making cuts for other for our cases and so on. So even though there were none that were identified in today's update, did not mean that those 5 cases were not part of the data that had already been reported to the Department of Health.
Next question.
Josh, Dakota News Now.
Go ahead.
So earlier this week, CDC Director Robert Redfield said that if everyone were to start wearing a mask right now, that basically the coronavirus could be under control in 4 to 8 weeks. It's kind of a pretty clear statement from the CDC there on what they think guidelines should be. Does this have any sort of impact on the state's mask guidelines?
So again, this is Kim Elson-Reisen. We will continue to provide that guidance to people in the state. It's clear on our website, and we'll encourage people to wear masks if they're in situations where masking makes sense. And again, that's going to be if you're going to be in close contact with other individuals, 15 minutes or more within 6 feet, or in other situations where social distancing is not possible.
Next, we have time for one final question.
Ray from Kellen.
We'll let both Lisa and Ray ask a question, and we'll go to Ray first.
Thanks. Hey, you talked about being notified if anyone had COVID related to Mount Rushmore. Let's reverse that or change that to say, has the state had to notify any neighboring states of people identified with COVID in as residents of South Dakota, where they've been at an event in Minnesota, North Dakota, or Iowa, where there's been a lot of people gathered? Maybe too specific, but in general, do you know if you've had to make such notifications to any other states?
Yes, we have.
Okay. And can you speak a little specifically if they were events or just counties or areas in which cases surged?
They were specific. The one that I can recall off the top of my head was a specific event. It was a family gathering.
Okay.
Yeah.
Thank you.
Lisa, we'll take your question now.
Okay. So there was increase in cases in Lake County. Are you expecting any sort of surge or spike in cases related to the high school athletics program?
So, as part of our investigation, we don't speak specifically about, an investigation, but what I would say is that as generality, we, are in contact with any individuals who may have been exposed, and that those individuals are, if they're symptomatic, are speaking with their healthcare professionals about testing, that individuals, who are asymptomatic, maybe reaching out to and have been exposed, maybe reaching out to their healthcare providers to talk about testing as well. And so, there is opportunity when a case is identified within the community to spur, some additional testing. Individuals who may have had mild symptoms previously, who might not even be exposed as part of that event. That does help raise awareness and does allow individuals the opportunity to speak with their medical provider about any illness, even though it may be mild, that they may be having. So, not unaware of any specific concern with positive case that we've seen in Lake County. And any potential additional cases that may be coming, other than individuals who are seeking appropriate medical care following potential exposures or development of symptoms.
All right, thank you for joining us